Congressional researchers say DEA likely to reschedule marijuana with broad implications for taxes, housing, immigration, and more. Congressional researchers say it's likely the Drug Enforcement Administration will follow the top federal health agency's recent recommendation to reschedule marijuana, which would have broad implications for federal policy in areas such as taxes, housing, immigration, military eligibility, gun rights, and more. In a report published on Wednesday, analysts with the Congressional Research Service gave an overview of the cannabis scheduling review directed by President Joe Biden last year and assessed the potential impact of moving marijuana from Schedule 1 to Schedule 3 of the Controlled Substances Act, as recommended by the U.S. Department of Health and Human Services. While DEA has affirmed that it's bound by the health agency's scientific and medical findings, it can still make a conflicting scheduling decision. But if passed as prologue, it could be likely that the DEA will reschedule marijuana according to HHS's recommendation. It pointed to an example of DEA following HHS's scheduling advice when it came to the synthetic cannabinoid product Marinol, which was placed in Schedule 3 in 1999. If marijuana is rescheduled to Schedule 3, it would have broad implications for federal policy. Also, this move would have significant implications for state medical marijuana programs and users of medical marijuana, but fewer implications for state recreational marijuana programs and those who use marijuana recreationally. There's some disagreement among experts about the extent to which rescheduling cannabis would affect state-level medical marijuana programs. CRS said such an action would make it legal to manufacture, distribute, dispense, and possess medical marijuana. But others say that without FDA approval and manufacturers obtaining DEA licenses, that would not be the case. CRS also said that a Schedule 3 reclassification would mean that state medical marijuana programs may now be able to comply with the CSA and will still be subject to CSA DEA criminal and regulatory control. Federal public health laws such as the Federal Food, Drug, and Cosmetic Act, and agricultural laws such as the Agricultural Marketing Act of 1946. The scope of and demand for FDA oversight for medical marijuana and related products may grow considerably. In the short term, FDA may need to generate or update a substantial amount of technical information to clarify its regulatory approach to marijuana for relevant stakeholders. Given that marijuana is a complex substance containing various pharmaceutical components and is available to consumers in numerous formats, FDA may also need to consider long-term resource allocation to ensure that marijuana products consistently meet applicable regulatory standards. Schedule 3 would also make it so medical cannabis patients would be eligible for immigrant and non-immigrant visas, and they could purchase and possess firearms. It added that the same rights would not apply to adult use cannabis consumers. Again, it's not exactly clear what steps would be needed for state medical cannabis laws and people acting under those laws to come fully into compliance with rules for Schedule 3 drugs. Colorado Governor Jared Polis, for example, recently sent a letter to Biden calling for FDA enforcement guidance to minimize economic disruption, promote state-federal collaboration, and protect the public's health while respecting current state laws. The new CRS report said that under Schedule 3, marijuana producers and retailers would be able to deduct the cost of selling their product, example, payroll, rent, advertising, for the purposes of federal income tax filings, adding that the reclassification would also free up research into cannabis. DEA would no longer set production quota limits for marijuana. Those who use medical marijuana lawfully may contend with fewer barriers to federal employment and eligibility to serve in the military. The report concludes by noting that Congress could separately choose to address any number of issues related to the potential rescheduling of marijuana, including by the independently rescheduling or descheduling of cannabis or placing it in an entirely new schedule. If the administrative scheduling process moves forward, Congress may consider whether to devote additional resources to the FDA and the U.S. Department of Agriculture to ensure the safety and quality of many different products already available in many state markets. I don't know what I think of this. I think that the CRS is a bit underestimating the impact that this is going to have on the adult use markets, but the way that they're suggesting this is that it will continue on status quo in adult use, and they'll get to do whatever they want and still not have FDA approved drugs and yada yada. And I don't see that going as smoothly as the CRS, these lovely researchers sitting at their whiteboards, seem to think. This is Gretchen for High at 9 News.
I totally agree with you on that, Gretchen. It is not going to be that easy on the adult use market if it moves to Schedule 3. That is without a doubt.
Because I would feel like if it's
never as easy
if
as
it's
we
not
want it to be.
classified, if they're not adhering to Schedule 3 rules, why should they get 280E and all these other things that come along with Schedule 3?
Well, at the same time too, Gretchen, I mean, how many of these facilities, I mean, look at all the things that you need compliant-wise to produce a Schedule 3 drug. And none of these facilities are equipped to be able to qualify to be able to produce a Schedule 3 drug.
There are GMP facilities out there.
Like there's a
I
couple.
wouldn't say
There's a
none.
couple.
I would
There's a couple. There's a
completely go
couple.
with
There's a
that.
couple.
I
There's a couple.
wouldn't say none, but it certainly is a high economic bar to hit to be GMP compliant to be able to produce FDA medicines. You need to be FDA registered at that point, and certainly there isn't a cannabis production facility on planet Earth that's FDA registered.
Yep.
That's not true. There's one in Santa Rosa, just to be argumentative and correct. But the barrier to entry statement is absolutely
Hold on
correct.
a second. Hold on a second. You're telling me that there's a facility in Santa Rosa that is FDA approved. That's a cannabis facility.
It was a previously FDA approved facility that was repurposed for cannabis. So the answer is yes.
No, all right. So there is no FDA approved cannabis facility in Santa Rosa.
There's a facility that's FDA approved that is currently repurposed for cannabis.
Exactly.
So getting it FDA approved for cannabis will be an easy stepping stone.
Yeah, but it's not approved by the FDA for cannabis.
Correct.
Okay, that's all that I'm saying. Perfect. Just want to make sure we're on the same page.
Dale, what are you thinking?
I just want to make sure we're not agreeing too much.
And I'm just going to add that the FDA doesn't regulate like plant products very well. So listen, I hate all of this. I am not a fan. I think we have to deschedule, remove it
That's right.
entirely. And then the component, what the FDA regulates is single molecule drugs. That's why we have compound pharmacies, is because other people have to combine the drugs later. So let them regulate. We need to pharmaceuticalize, we need to medicalize this whole thing, yes. And there's a path for that. And what we need to do is legalize research. We need to deschedule and allow for that path to happen, not try to stuff what's already happened, the toothpaste, back into this bottle. At the end of the day, my husband pointed out, Jeff Jones pointed out to me, Dale, we've been ignoring what the government has been saying for 25 years. So we may in fact continue to ignore that, but it brings in a whole nother level of bureaucracy and confusion. And it's simply because a few politicians were told, probably by Americans for Safe Access, bless their hearts, that this was the solution. And it's not. We can't accept this like some fucking easy solution. That's what I really think, Gretchen. Thanks for asking.
So you're telling me we can blame Americans for Safe Access for the fact that it's going to Schedule 3?
Blaming Americans for Safe Access. However,
thanking Americans for Safe Access, because they've been saying Schedule 2 for a decade. And listen, we've supported ASA. Oaksterdam's been one of the first early and often supporters of ASA. On this point, we disagree. And they have been pushing, and they're in the ears of a lot of politicians in Washington. They are very effective at what they do in representing patients. And I believe in needing pathways for patients. Again, legalizing research is a great place to start, because right now it's so bogged down as to be a joke. It's not going to happen by stuffing it into a Schedule 3 and expecting Walgreens to deal with it.
You should have said stuffing it into a Schedule 3, Dale.
Jason, I wouldn't say that the term is blaming, but this is the main problem with the cannabis industry, is everyone has their own agenda. It's the patients, adult use, cultivators, retailers.
Well, first of all, I am a
They all want
patient.
different
I am a
things. They
patient.
can't come to a consensus on just the overall bigger picture to make it work. And so that's how we get into fighting against each other and not getting anything done. And so, yes, patients may get helped here, but then they're
not going to get helped. Patients are not going to get help. Patients are going to get screwed in this whole deal.
Patients are going to get
screwed.
Medicine.
SCRWED.
Some may feel better about getting an FDA approved drug.
There's no
I'm
cannabis
sorry.
company that can even pay to
can
get
walk
through a
into some of these-
FDA,
Will you
get
feel-
any
will you feel
SKUs through a
better when you
FDA.
get-
Dr. Talleyrand, can you touch on this, please?
Yeah,
Bring these
I
people
love
back to
this
reality.
conversation, guys.
Bring these people
Can we
back to
walk and chew
reality.
gum at the same time, Dr.
Hey,
Tyler?
how long?
Yeah, we
how long
can.
how long did it take the FDA to pull all that cough medicine that wasn't working, all that Sudafed,
Mhm.
DE? How about that? How many dollars were spent on that?
Well, we talked
Let's
to Dr.
just-
Talleyrand and the state of medicine in this country. Let's hear what he has
Let's
to say.
let's just remember that the FDA and the DEA are two separate authorities.
Correct.
And the FDA regulates medicines or substances for safety and efficacy, while the DEA decides whether something is criminal or not, right? So at this point, the Controlled Substances Act is about the criminality of cannabis, and doesn't really say anything to the FDA. And you know, I spoke to Dale Garinger a week ago, and he was ecstatic about this because he's been trying to get folks to move the needle for a while, despite the fact that there might be some issues. He felt it was an incremental step forward. And you know, I agree. I think we're going to get more research from this. And in terms of recreational users, you know, now it's Schedule 3, or it will be soon be Schedule 3. It doesn't really change the status for you guys. You can still grow your weed in your backyard in a state that allows you to have it legal, and you can still sell it among yourselves. So it shouldn't really change anything.
So you're
in terms of
advocating for the trap is going to live and all the dispensaries are going to close down because they're not going to be able to get through the Food, Drug, and Cosmetic Act.
No, the dispensaries won't close down.
Why will they be able? How will they be able to stay open if the FDA regulates everything by the molecule? They already have drug preclusion on THC and CBD, and therefore every single product inside of a dispensary would fall under the Food, Drug, and Cosmetics Act.
Because they're open today.
But it's under
It
the
doesn't
notion.
change their
But the FDA has no jurisdiction over us while it's a Schedule 1 drug, Dr. T.
It won't have any jurisdiction over you if it's a Schedule 3 drug.
I disagree with that.
No, it doesn't change their
I
power over you.
disagree with that. I think the FDA is going to come in and screw everybody over.
They don't have any cops to come in anywhere.
They don't have to. All they have to do is start sending letters. All they have to do is start sending letters. The Office of the Attorney General is very good at sending letters out and was very, very disruptive to a number of businesses.
To the 6,000 plus dispensaries out there that receive a letter from the FDA. Meanwhile, the state backs you up and allows you to sell cannabis.
There's no guarantee that the state is going to back you up if the FDA comes down and says that there's a problem going on. There's no guarantee that any state is going to back any of these cannabis businesses up.
Isn't the FDA saying there's a problem now?
The FDA ain't saying anything about it now because they don't have jurisdiction over it.
Well, I think they're saying it's
There been a
Schedule
state by
1.
state? Is there a state by state? Because a lot of states also wrote into their laws that if the federal government or when the federal government changed, that they would adopt. I'm just curious how that would also, how that shit would roll downhill.
There we go, Dale.
Well, I mean, Polis even said he's looking for some guidance out there. So I think that in states such as like Colorado, California, which have very large cannabis markets, I think that these governors are going to look for guidance, but they're going to protect their state market.
No, they're not.
Because they want to protect their tax dollars.
They don't give a shit about that.
Yeah.
All right, move on. We got a lot of people on this page.
Yeah. Oh, yeah. They don't give a shit about that. Just saying. Just is what it is.